All right. Welcome back to episode 2 of BurnCast. I'm excited to have Ann and Liz back, and today our topic is going to be about what to do when a dressing falls off. Take it away.
I think when it comes to a dressing falling off, the number one thing I would say is call the burn team, which I know is not always an option depending on the time or whatnot, but we have a burn surgeon on call at all times. We have nurse practitioners during the week. We are happy to take calls. We are happy to get information, especially if you have a question about it. We'd rather be called than not called.
And what are the times that nurse practitioners are available in the hospital? What are those times?
Yeah, good question. Our nurse practitioners are available in the hospital 6 a.m. to 5-ish p.m. Monday to Friday. And outside of that, our phone rings to the surgical resident. So if you call our nurse practitioner phone number, then it'll go to the surgical resident and they are able to go up the chain of command or the surgical fellow to get to the burn attending on call if need be.
And what's that phone number? Because I don't think everybody knows that number.
Sure. It's a 202-476-8212.
8212. I'm trying to think of a fun way to maybe make a song about, I need help.
I know. I'll let you work on that, Cindy. A jingle.
So like walk us through the steps. If we'll just say like a Silvadene dressing, the kid, it all unraveled. What do you do?
Well, I think the first thing that you should do is make sure that you have all the supplies you need in the room. And don't be afraid of it. I mean, this happens. Kids are moving around, things are going to shift, they're going to fall. Best to really just kind of like tackle it, make sure that the wound gets a good clean and you replace a dressing quickly. So I would say the first step is make sure that you have everything you need. So it would include something to clean the burn, like wound cleanser. If it is a Silvadene dressing, I'd make sure that I have enough available from pharmacy, always on hand. Gauze to put the Silvadene on. And then we can talk a little bit more about wrapping, but a 2 or 3 inch cling is pretty stretchy and that's going to really help it stay in place. You may also want to consider putting, a Tubifast garment on top of it, either a shirt or leggings or doing something creative as well.
And where do nurses get Tubifast garments from? Where do they live?
They are stocked on the 5th floor in our supply room. So if you're in the 5th floor, you can get them there. And then I think they come from Central.
Mm-hmm. I would check with SPD.
I think is probably the best way to go about it.
So Central Supply?
Mm-hmm.
Yeah.
Okay. So because the PICU, I don't think that they have the Tubifast garments. So what if, Liz, and I think what you said was really good about like making sure that you have enough to cover the burn if the dressing comes off. So say it's a weekend, it's a Silvadene dressing. They're normally done by the surgical team, not by nursing, and they don't have the supplies and the dressing is completely saturated in stool. What does the nurse do in the meantime of waiting for surgery to come to the bedside or waiting for Silvadene to come from the pharmacy? Because you don't want them to sit in stool on their burn, but if you don't have the stuff to cover it up, like does it have to be wound cleanser? What if they can't find wound cleanser? And they also don't want to have the burn open to air because you don't want it to dry out. You also don't want the kid to get cold. So what do you do?
Those are all really good points.
Good questions. Yeah.
Yeah. So I can start with, if you don't have wound cleanser, soap or water, just think of this, local wound care. So what are the concepts? Certainly we want coverage, but we also want clean. So the first thing I would do, remove all the soiled dressings, clean with either soap or water, whatever you have on hand. If there is stool, I certainly would want something, that would get rid of all the germs. So clean it. And then perhaps place dry 4x4s over the wound once it's clean, and then you can assess what else you might have on hand to cover it. So, and I'll let you take it from there.
I think another good option is Xeroform. So if you're like, we don't have our Silvadene, we're waiting for pharmacy, we don't know how long that's going to take, dry dressing or a Xeroform because it's less likely to stick if you have it. And then get it back into whatever that dressing is as soon as you can.
In clinic, we like to use a technique where we clean And then as we're, opening a dressing or deciding what we want to put on, sometimes, kids get a little upset by what they see. So, if a 4x4 over the wound, just to kind of keep it just for a couple of minutes while you regroup and grab your supplies, is a good strategy as well.
Yep.
When you said soap, most of the soap that's available on the floors, it's the Johnson and Johnson's baby soap. Is that the type of soap you were talking about?
Yeah, absolutely. Absolutely.
Okay. And should the water be warm, or do they just get it from the tap? Does it need to be like the sterile water? Like what type of water? Because I know that that would be a question. Like, do you just get it from like just the faucet, or do you have it kind of comes from a bottle? And what temperature does it need to be?
Just warm tap water is fine. Sometimes it takes a little while for those hospital sinks to warm up. So, but it doesn't have to be sterile water. And it's more pleasant for the kids if you don't use very cold water.
Right. So when you say clean the burn, so this is only in a case of if the dressing falls off or if it gets soiled. So of course we don't want to put a new dressing on like a dirty wound. So you want to make sure it's clean. Now, different dressings look different. So like Mepilex AG, that's really easy to like pull off and then put a new piece on. But Silvadine's gross and it gets yucky and it's goopy and it oozes. And like, are you supposed to clean that all of the old Silvadine off as well as the soiled part?
Yeah, that's a great question. My favorite thing to say about Silvadine is that it's the most beautiful color. It's like this pearlescent white. It's gorgeous. It goes on like perfect and it comes off foul. Like it comes off yellow and brown and slimy and it looks like it's pus and it's not, but it's supposed to, and that's how it's doing its job. But it does leave a little bit of a film. So if it doesn't peel off nicely like Mepilex AG. So if you are taking off a Silvadine dressing and add to it whatever has soiled it, so I'm sure you've got some extra niceties in there, just get it all off and then wipe it down. And you want to treat this a little bit like you would a skinned knee, if you can think of that, if you've ever had a skinned knee or a wound like that, and that you want to get any debris, any layers of ointment, any like bleeding, any dead tissue, you want to get any stool, any Silvadine, any old ointment or anything off of the burn, and just use that soap and water or wound cleanser to do that.
Okay, so a nurse shouldn't freak out if she's cleaning or she or he is like wiping off all that like nasty gook. The nasty gook is normal. That doesn't mean that the bird's infected. That's very normal. So yellow, gross, foul discharge from Silvadine is not indicative of an infection. It is normal.
Yeah, we look at the burn once we've cleaned it.
I think, just. Yeah, and I think, again, just, making sure that you have a nice pink wound bed. I mean, the way the Silvadine is working, every time we're putting it on, it's really penetrating the protein and everything else the body is really trying to heal itself with. So every time it's applied and then, subsequently removed and changed, it's actually working its way to a nice pink, healthy wound bed. So again, looks gross, but I would certainly be on the lookout for any surrounding redness, really bad smells, anything that might indicate there was something serious going on.
So when they are like wiping off and cleaning and some skin comes with it, or if it starts to bleed, is that cause for concern or is that normal?
That is very normal. It's, where healthy tissue bleeds. So sometimes when the Silvadine has worked off the layers of that white kind of proteinous gunkiness, once that comes off, you do see bleeding. That's very normal. You can just use a clean gauze to hold gentle pressure. And once you have it dried and it's not actively bleeding, put your new dressing on it.
So I think that's a really good point because I think that, since we are a hospital with family-centered care, we have parents at the bedside all the time. And if we have a nurse that hasn't done a whole lot of dressing changes before, and now they're scraping off this stuff, and then the legs or the chest or the arm, if it starts to bleed, and a parent is like, oh no, like now my child's bleeding. I think that's a good thing for the bedside nurse to be able to say is, you know what? And I think you said it really well, where you said healthy tissue bleeds and that it's doing its job and don't worry. Are there ever cases where the bleeding doesn't stop or that you have scrubbed too much?
I don't think you're going to get yourself into too much of that situation. But if you do, you're just going to hold pressure for a little while. And sometimes if the bleeding's still kind of slowly coming, I stick the new dressing on top of it. If you can't really get, and just make sure you wrap it up with enough layers.
I'll tell you, faces, when you clean faces, they're really prone to bleeding because the skin is so thin. So we ask that people use a lot of caution around the lips. If you think about how sensitive chapped lips are, how easily they bleed, again, kind of that same philosophy to the face. So one technique we like with the face is using a special cleanser. It's called Vash cleanser. Comes in a blue vial. And we put a teaspoon or so. So we don't saturate, but we put, a teaspoon or two onto a 4x4 and let that soak over the child's face, if they'll let you, of course. It's a nice technique to, instead of, just trying to hold them down to scrub, it just kind of helps to soften everything up. So again, there's some areas that certainly bleed more easily than others, but again, use pressure.
Do you wash on other areas or do you just use it on the face?
We will use it on other areas as well.
Okay. And where do you get Vosh from?
It comes from pharmacy, so does need to have an order for it.
Okay. Is that something that you order for every burn patient or just specific burn patients?
I think specific burn patients, oftentimes wound cleanser and soap and water gets the job done, but especially for faces, as Liz was talking about, if Vosh really sits to debride, then it can help with the removal of the dried drainage and exudate from faces.
Okay.
Yeah.
Okay.
It's interesting.
Go ahead.
Oh, I was just going to say, it's interesting stuff. If you smell it, it smells really strong. It has almost like a bleach-like smell, but we've been reassured. I mean, even if it's incredibly gentle, so don't be afraid of it. It does smell strong, but nothing to be afraid of.
We may also use it on a burn that we're worried about being infected or that we really want to deep clean, because it works kind of like the neutrophils in your body and it kind of eats at any infection, and can clean up. So we may soak it on an area for 10 minutes if we're worried about the cleanliness of another area.
And Liz, you were saying that you use it a lot on faces.
Mm-hmm.
So if the Vosh, because it's a cleaning solution and you're saying it smells really strong, if it gets in the eyes or the mouth, is that something we need to call poison control about, or?
No, we've been advised that it's gentle stuff. So it's okay.
Don't drink it, but it's okay.
Right.
Yeah.
Right. A little bit. Yeah. I wouldn't go out of my way to get it into the mouth or into the eyes, but if it does, it's fine. It's very gentle.
Yeah.
Okay. So we talked about a lot about what to do if a Silvadene dressing falls off or it gets soiled. But and Mepilex, correct me if I'm wrong, but Mepilex is just the sticker, it's that orange, it's not orange,
Gray.
the gray
Yep.
foamy sticker with the cling around it.
Mhm.
And if that dressing gets dirty or falls off, you can just take it off, put a new one on after you've cleaned and call it a day.
Mhm.
What about if our last episode, we talked about Suprathel, and that's placed in the OR, right?
Yes.
Okay. So say we have a kiddo with Suprathel. It is Saturday night. It's 11 p.m. on Saturday night. And the child stools all over and saturates all of the dressing around, on, and just is nasty all where the Suprathel is placed. What do you think?
Well, so that's a really good question. And I'm actually going to even take it to a little bit more intense level and say if it's Suprathel or even more importantly, a skin graft.
Okay.
Because skin grafts, we want to know if something happens immediately. Like the burn surgeon on call needs to know about it. And I'd put Suprathel kind of close to that level. Suprathel, and we talked about this in our last BurnCast, we often wrap it pretty intensely, and sometimes it has, we put extra layers, or we put an ACE wrap or Coban or something on it that gives it a little bit more protection. So if you can get off from whatever the exterior layer is, like an ACE wrap, like if you can unwrap an ACE wrap and rewrap an ACE wrap, hopefully that's great. If it really is penetrating and you think it's penetrating down to the wound and it's stool or something infectious, and there's a lot of layers of padding, I would say just leave it and call the burn team. And if you're not getting a response through the resident, escalate to the fellow, and they need to escalate to our burn surgeons, because our burn surgeons care about those kind of long acting operating room place dressings. And they would rather take care of them than find out about it the next day. And when I mentioned a skin graft, a lot of times our skin grafts come back with a wound vac in place.
Mhm.
And we want to know about vac failure when vac failure happens. Like, we don't want to kind of find out about it when we round at 6 o'clock in the morning. We really, that's cause for don't mess with it and just give us a call.
So that's classified as an emergency. So if
Yeah.
dressings that are placed in the operating room, if they truly get saturated, or if there's back failure with anything, that's an emergency, and that is not like, you shouldn't really play around with it. You should call the surgical team.
Yeah,
No matter what.
especially with skin graft, they've shaved off a patient's skin and placed it surgically into another area. So we need that skin to take, and we don't want to lose it. Suprathel is a dressing that we put in place so we can kind of mitigate some factors, and we do want it, but especially when we've done a surgical procedure and kind of relocated a piece of skin, we really want to give that skin the best chance it can to take. So please don't hesitate to call us if you think there's a problem with a skin graft.
Okay, and that is, it doesn't matter what day it is, like, always call the
Doesn't
surgeon.
matter day or time
Absolutely.
or anything, we want to know.
Mhm.
Yep.
Okay. What about, I feel like we've talked a lot about like the complex dressings, but sometimes we have a lot of kids with a ton of just a Xeroform on them.
Yeah.
And Xeroform is not the easiest stuff to work with. I've noticed it's really slippery. So
Mhm.
once you touch it, you're committed.
Yeah.
So if you have a kiddo in that, at like, how long do they last in it? Like, how long is it before like you change it? And does it turn different colors like Silvadene? Does it smell different? And what would you do if that dressing got soiled?
So that's a little bit easier. I mean, Xeroform is, let's just first start with what it is. So it is a yellow bismuth, bisthmuth, bismuth impregnated dressing. And so it's a Vaseline, basically. It's a nice greasy dressing that we put on things that are that look pretty good, that are partial thickness wounds, so those nice pink wounds. It's a similar type of care like Silvadene, so daily cleansing, thin layer of the Xeroform, and then wrapping it with Curlex or Cling or whatnot. And it does smell funny. It's hard to describe the smell. I don't know what
Yeah. I don't
Weird.
say.
How do you describe Xeroform's
Yeah.
smell?
Does it smell worse?
A little
Like, does it smell worse the day after, or does it smell about the same?
It's got, like, when you open it up, almost like a little bit of like a medical ointment smell.
Yeah,
I don't
Yeah.
know how else
it's
to
not
explain
bad.
it.
It's just
I mean,
strange.
And sometimes the surgeons will put on Xeroform in the operating room and leave it on for a few days, but generally and if that's the case, then we will have a very specific order for you. So I would say, try and go back to your orders if we should have a burn order that tells you like dressings to leave in place or dressings to be changed daily, like okay to that kind of thing. If it's a daily dressing change with Xeroform or Silvadene or something like that, then you can proceed with changing it if it falls off. If we have Xeroform on the genital area, we do it with dressing changes daily and every time soiled. So you may be changing that Xeroform with every void or stool. Just adding on a new layer. And you're right about it getting really greasy and slimy. I always try and remember to cut my pieces of tape before I start touching the Xeroform, but inevitably I don't. So yeah, it can be challenging.
So I think as we're wrapping up, if you could, and I'd love to hear both of your top threes. What would be your top three most important things for people to walk away from this knowing about what to do if a dressing comes off or gets soiled? And you can go first.
Oh,
Sorry.
great. Thanks. Sure. My number one is please call us. Like, we're happy to hear. Okay, if the surgical resident gives you anything, come talk to me when you find me the next time and we'll deal with it. But please call our team. We are burn surgeons, our nurse practitioners. We really, really would rather help you through a problem. Even if you have a question, you're like, can I put some Xeroform on this? Can I put a new Silvadene on? if you're doing it and we're not coming to the bedside for it and we're walking you through it, we're happy to be involved with that. So please don't hesitate to call us. The other thing I would say is that generally anything that's open and moist, if it has a dressing on it and the dressing falls off, please put a new dressing on it, instead of kind of just leaving it open to air. Now, faces are a little bit different, and we can talk about that in another BurnCast, and ointments and Aquaphor gets used on open areas on the face. But if a dressing has something on it and that something comes off, try not to leave it open. Let's get something else onto it. And then number 3, I would say, don't be afraid of burns. It can seem overwhelming, but it's really just about keeping a good, healthy, clean, moist area for that burn to heal. And don't be afraid that you're going to do damage to something by kind of cleaning it or changing a dressing, unless it's a skin graft.
That's funny. My number 1 was, again, don't be afraid of it. I mean,
Yeah.
just the nature of these dressings, we're trying to keep them on for 3 days, 4 days on a wiggly toddler. So certainly, I mean, go for it. Use the tape, maybe change out one of your Tubifast dressings, a Tubifast shirt. So again, don't be afraid of it. Just work with it. You may have to rewrap here and there, and just don't get frustrated either, because again, this is tough. We're asking a dressing to stay on a little one for a moderate amount of time. I also want folks to know what to look out for and when you should be concerned. If Mepilex is placed and there's an overlying Curlix or cling plus a Tubifast shirt, really the nature of Mepilex is that it drives moisture out of the wound. So you may see some spotting. Similarly, to a skin knee, if you put a Band-Aid on, you may see a little bit of blood or, fluid seep through. So a little bit, okay. If you have to wring it out, obviously that's cause for concern. And then I guess my number 3 is if there are dressing concerns, working with the team, take it down, because burns can change. They can evolve. They can become deeper over time. And that's nothing that we want to ignore. So anything concerning, lots and lots of drainage, pain out of proportion to the injury, definitely take that dress, see what's going on.
And then the top 3 things that I've taken away from this is that if you have a dressing placed in the OR and something bad happens to it, it's an emergency, and call. Don't be afraid to call, just call. Monday through Friday, you can call the nurse practitioners, and the number's 202-476-8212.
And the jingle's pending. Cindy's going to make one.
The jingle is pending. I know the Mr. Yuck. I know his jingle, but I don't have one for nurse practitioners yet. And then the third thing is that if you don't have all the supplies, one of the easiest and readily available supplies for an emergent burn dressing is Xeroform. But make sure before you replace any dressing to make sure that the wound is clean, and that Johnson & Johnson soap and warm tap water is fine to do anything. All right.
Yeah.
I have one more.
Oh.
Pain medication. Pain medication. How do you
Yes.
get pain medication?
Please pre-medicate.
Yes. Remember, we want to just stay on top of procedural pain. So pain medication.